This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle and the Roselle Center for Healing present Ageless Health 2014, Proven Tools to Maximize Your Health, Saturday, October 18th at the Fairview Park Marriott in Falls Church, Virginia. At this all-day seminar, learn how you can feel better or feel great when the doctors from the Roselle Center for Healing each discuss a topic that directly affects your health, like your food, physical fitness, preventing injury and disease, your healing process, and more. Learn more at agelesshealth2014.com. That's agelesshealth2014.com.
Dr. Tom Roselle live right now on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle live in studio just for you. Even though that's the 4th of July weekend, we're here and we have a lot of really neat information for you, kind of things that'll challenge you. But nevertheless, this is what we do. This is why we're dedicated to bringing you the most intimate and updated information and integrative and natural health care, from nutrition to chiropractic to acupuncture, all those things that you wanted to know a whole lot about, but guess what? Forgot to ask somebody who really knew. Well, these are the people that know us right now. 888-630-9625. That's 888-630-9625. Love to talk to you on any subject that you have in mind. We've got one, and we're going to explore it, and I think it's going to surprise you. It's going to give you data that you didn't know that exists, and to help me do that, my guest in studio today, your host this Wednesday evening at the Roselle Center for Healing, Dr. Scott Lamp.
Good morning, or good afternoon, I should say.
It is the afternoon. So you give it a couple days off, and your brain goes out. You really don't know what day it is anymore.
You know, we had kids on a sleepover, and it just threw me off the whole day.
See, I'm beyond that stage now. I just have to worry about my grandkids. Listen, I got a question for you, Dr. Scott.
Shoot.
Okay, so what does Abbott Laboratories, AbbVie Incorporated, and Eli Lilly Company have in common?
Lawsuits, it's a possibility?
Exactly. Congratulations. You won the $100,000 question. Perfect. And what are they being sued for?
It has something to do with testosterone, I believe. It's probably some type of testosterone booster, I would assume.
Yes, indeed, sir. You are right again. Correct. Congratulations. I'm proud of you. Good job. Actually, our program today is about uniquely male and all the hormone crashes and cycles that men go to, but they don't want to talk about. They don't want to ask. But, today the big thing is, it's got to be low testosterone. And everybody's running off to their doc, and they're getting their pills, and they're getting their gels, and they're rubbing them on. And the problem is that there's huge side effects.
There's a tremendous amount of side effects, like, for example, let's say heart attack, stroke. We got some of those things. There's some major aspects, implications. And you were talking about the lawsuits there. I believe they're right now, currently, there are about 45 in place in regards to using some of these substances.
It's really incredible, and you have all these guys out there like Science and Kirk and so forth. You know how they advertise on television. If you suffered from, cardiovascular disease, strokes, cancers, tumor formation, peripheral artery disease, and you've ever been on any kind of testosterone supplementation, call this number now. And it's not playful. It's one of these things that is really true. Obviously the legal society, we're in a very litigious world today, are jumping onto it, but the truth of it isn't something that we've been talking about for years. I've warned men, do not do this. There's a different way. Your body wasn't supposed to go into testosterone crash unless you'd had a testicular amputation.
Right.
And, at that point, then there's other things that you do, but it has to be done in a very, very specific, natural way. So let's talk about it a little bit, and then we're going to get into the meat of this. This Wednesday evening, July 9th, 7:30 p.m., Dr. Scott is going to be talking about uniquely male. Ladies, if you have a husband that is kind of grouchy and he's irritable and he's, somewhere between 35 and above, sometimes 30, it's getting lower and lower because guys are losing their sperm counts. They don't function the way they used to. Interesting thing, guys who are in their early 30s today have the sperm count of guys who were in their 60s and 1950s.
That's right.
I mean,
it's
like
you stole my quote, by the way.
I'm sorry. Well, you stole it from me first because I've been saying it a lot longer than you have. So, but the bottom line is that that's true.
Yeah.
And testosterone levels and we're going to get into the why behind that. But, guys get grumpy, they get agitated, they get miserable, they hurt, their back hurts, and seemingly out of nowhere. And they're losing muscle mass and so forth.
It's a gradual thing. I think one of the things is I think when we talk about, sometimes we talk about testosterone and erectile dysfunction and those kind of things. Another sign or symptom you might want to think about and kind of question yourself about is that usually a male, when he wakes up in the morning, will have an erection, and then basically they go to the bathroom and then that takes care of it. Another sign, a subtle sign, is not having early morning erections. And one of that aspect is again, low testosterone, the libido is starting to go, and that's starting to happen with people in their 20s now.
Yeah, that's amazing to me. But when you ask the question, why is that?
Yeah.
Why is it happening? And it begins to show evidence. And let's talk about that. Why are men, by the way, ladies, you know that you go through perimenopause and menopause symptoms, and some of you do what you're supposed to do, and you go through it without a problem. It's just a nice, easy transition. You just stop your menses, and nothing else happens. And life goes on beautifully, as they do in Asian countries and every place but the United States and the industrialized world. But in this country, the lumps and bumps and the aggravation and the attitude and so forth that goes along with it, and, lovingly they say, well, it's my hormones. Or guys say, well, it must be your hormones, and that's when you want to kill them.
Right.
But nevertheless, guys do the same thing. It's called andropause, but because we're male and we have attitudes, we don't buy into the fact. But guys, guess what, guys? You better buy into it because it's true.
Right. I think one of the things is we're going to talk about many different factors that go into this increase. This is not just, oh my God, my testosterone's low. The question is why? Because if you feed that one particular thing, you might have missed about 5 or 6 other different elements that might be creating this in the first place. The thought process behind what we do at our offices is actually looking at what is really the problem that's causing the body to adjust itself to lower testosterone, and there's a lot of different ways that's happening.
We're talking about not only a natural phenomena that should be like a normal menopause situation, an easy transition, but one that has turned abruptly against everybody because of environmental situations. But it's also big money, and I'm just going to touch on it for a second.
Huge.
Abbott Laboratories and AbbVie Labs have been accused of putting together an $80 million marketing campaign to promote Androgel, one of the things that you see on television all the time. Low T television ads, right? When you're complaining of low energy and lack of sexual drive, and, said, well, listen, hey, take this stuff and everything, life is good again. But let's get to the fundamentals. Let's talk about why guys are falling apart, why they have back pain, why their legs hurt, why they have headaches, why, all of a sudden out of nowhere. This is a lifestyle situation.
Right.
And also something that is being done to us, but we buy into it and we don't ask the question why. And let's talk about environment. Let's talk about all the things that are out there that are causing men's problems that we see today.
Well, I'm just going to use a technical term, endocrine disruptors. What the heck are those? Those are basically a lot of times like estrogens that are in our food supply. They're things that they're used on insecticides, herbicides, and fungicides. They get sprayed onto our vegetables or whatnot. We're consuming those. We're not washing them off. Or some of the stuff you just can't even scrub off. You take an apple with the wax on it, and you get some of the things that are on there. You can't clean that off.
Lawn sprays.
The lawn sprays, those things you're getting on your feet and those things. Plastics in the microwave. Those things breaking down there. And, of course, you can actually have a chicken go to maturity faster if you have them on hormones. That hormone does not break down in the meat. It actually transfers to the next person in the food chain, which is us. And so we're starting to see some changes. And, we talked about, I think, in the past about the element of like girls actually having breast maturity early menses, now starting at the age of 9. Where they're not supposed to happen at that particular time. It's actually forcing the issues faster. And also it goes to the male. The male's getting experienced some of these. And now we're starting to see a lot lower sperm counts on people because of and it's really located in the United States when you start looking at some of the other countries outside of it, that we have a lot lower sperm counts in some of the these other countries.
888-630-9625. That's 888-630-9625. Love to take your calls on any subject. We're talking about uniquely male andropause. That's the same thing that women go through with menopause. Well, this is for the guys. And this Wednesday evening, Dr. Scott Lamp will be your host at the Roselle Center for Healing. He's going to talk about specifically that, uniquely male. And ladies, this is probably a great class for you to show up and grab your guy and bring him with you, because you go away and you're going to learn how to fix this thing. And it's straight up. and we're going to talk about resistant patterns in the body in a little bit and what that means and why, even when there's a normal testosterone level, nothing's working. If you'd like to attend Dr. Scott's presentation, all you got to do is call 703-698-7117, 703-698-7117. Tell my staff that you'd like to attend. As always, our in-house continuing education programs are a gift to the community. We do these to educate you, and for no other reason. I mean, just show up. But the problem is that we need reservations. We have limited space. Once that space is filled, we can't take any more people. So 703-698-7117. And our number here is 888-630-9625. Dr. Scott, as we go through, we talk about male hormone cycles.
Yep.
And, let's talk about that a little bit, because men have cycles just like women. They're finally getting around to it. There's guys at Georgetown University and some of the European schools in Britain particularly that really get this and they understand it. But because of our cultural identity, our self-image, we kind of deny them. We don't want to look at them. We kind of say, not so much. But there's tons of papers out there by leading scientists throughout the world, and they're talking about these cycles. Let's talk about that for a little bit.
Well, I think we have like circadian rhythms that are supposed to be natural elements that we have, and I think one of the problems with the testosterones is when you're looking at it, they have such a broad range right now currently that everything seems to be looking in kind of normal, and I think we need to kind of narrow those down a little bit and then see these like circadian rhythms that the body has, and be able to identify that and kind of work with those. I think that's one of the key things to look at. Also, another a hormone to look at is the adrenals. This is another hormone that actually can steal from our testosterone. And if that's not regulated right, again, another one that's on our circadian rhythm that needs to be taken a look at and measured the correct way.
There's an interesting thing. Here's a toss-up question for you. Do you know why more babies are born in the springtime? From about January all the way through till about July?
Let's see. You got to get me on that one.
Okay, so from April to October, there's a decline in male sperm count. But before that, there's a 16% increase in testosterone. So add 9 months to that, and you can see what happens.
Okay.
See? Trivia. I'm good with trivia.
I wanted to go with sunlight on that, but that wasn't going to work.
Well, actually, there's a thing about that, too. There's male hormonal levels go daily, they go seasonal, and they have annual rhythms. Yeah. And it depends on where we are. Chinese know this stuff, and
right.
They get it. When I was in China a couple of years ago, and, we were really educated into the natural balance that occurs within our lives and within our hormone systems and so forth. And there's certain energetics that are up and there's certain energetics that are down. But the bottom line is that guys are suffering needlessly. And I really want to focus in on why some of these things take place. And, you touched a little bit about on the plastics. We touched a little bit about, the stress levels. But let's talk about it. We've got 2 minutes before we have to go to a break. But I want to just kind of set the stage for what we're going to talk about in the next part of the program. 888-630-9625. So why do we find in today's culture, with everything supposedly progressing, that we have all the tools, all the drugs, all the, the things that make life better, supposedly? And we find, particularly in Western culture, things are degrading, and men, it's called the vanishing male.
Right.
I mean, we are losing the male capacity, period, across the board.
One of the things, we got to go with several pathways. One is going to be, again, I'll talk about the adrenal element. And in fact, I was listening actually to WMAL. It was I believe it was a Wednesday night. They were talking about the people dropping dead in China in regards to the stress aspect. There's so much stress there. They're only allowed to have necessarily one child. There's a lot of stress on that individual to support the family, and they're actually literally dropping dead at work. And the stress element plays a lot of part, because if we're stressed out, the body's going to look at a primary reflexes as I'm going to survive, and what's going to suffer is some of my male or my hormone elements are going to suffer for that, because I need to survive on that particular type of, that route. And so, I mean, that's a major aspect. They're expecting more and more of us, from all the things we do and all the gadgetry that we have, and we have less and less time.
You and I talked about something on the way up to the program today. We talked about resistant patterns, just the inability of hormones to transport into the receptor sites, and I'm going to talk about that when we come back from the break. But the inability, we've talked about insulin resistance, and I don't think people really understand what that means. It's the inability of insulin to transport blood sugar in. But the resistance patterns in every other hormone as well, from thyroid to testosterone to estrogens to progesterones. And that's part of this whole problem that we're seeing today. We're getting resistance patterns. We'll be right back after this message. Don't go away. You're listening to Dr. Tom Roselle Live.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live in studio on this almost the end of a beautiful 4th of July weekend. What a gorgeous, gorgeous few days we've had. I hope you've had an opportunity to get out and enjoy it. Hit the beach, go to the mountains, drive around, go downtown, have some fun. 888-630-9625. That's 888-630-9625. That's how you find us here at the studio. Waiting to take your phone calls. My guest in studio, Dr. Scott Lamp, who will be your host this Wednesday evening, the 9th of July, 7:30 p.m. at the Roselle Center for Healing in Fairfax. We're right off the National Capital Beltway. We'd love to have you as our guest. Free presentation. We do these on an ongoing basis on different topics. For those of you who have unaware of it, this one is uniquely male, and it's about all you guys that get grumpy and grouchy and hurt and have heart problems and are worried about strokes and so forth. This is a thing that you need to really know about. We're seeing dramatic drops in testosterone. Dr. Scott, before we get into it, got a lot of questions for you. The second half of the program, we're going to get into more intimate pieces of this. But coming up, October the 18th, Ageless Health 2014 is our annual presentation. You're going to be there. We're going to be talking about some amazing things. This year, Ageless Health 2014, proven tools to maximize your health. It's a Saturday. It's the Fairview Park Marriott Hotel in Falls Church, Virginia. Love to have you. Go to rosellecare.com. That's ROSELLECARE.com. And register until the 11th of the month. You can register for $59, and that includes your lunch. It goes early, it goes late. This is a day that will change your life forever. It's a day that you're going to go away with tools that you can use immediately. You're going to learn what kind of blood tests that you really need to have, what they mean. You're going to learn how to apply them in not in your life, but your family's life. You're going to know what to ask your doctor for when you go get your annual physical. Ageless Health is the most effective way of learning how to create a healthcare plan that will change everything for you. Your body's extremely forgiving. It'll turn anything around. You know that fat you got around your midsection you can't get off? There's ways of making that happen if you understand what the mechanism is. Tools that you can deal with allergy reactions and so forth that you can do yourself. Your must-have lab work. It's not the stuff that your doc wants, but really understanding how to assess the body, what their signs are. And did you ever wonder how something really small, a small injury, all of a sudden over a period of time becomes huge, and you wonder how you got there? How about you're at the age? Guess what? You walked in the room and you forgot why you came into the room. Unfortunately, that happens to too many of us, and we're going to give you 10 steps to help improve your cognitive patterns and stop decline. But in addition to all that, everybody that comes will be registered with $1,000 worth of health care. Imagine that, $1,000, $1,000. Don't hesitate. Do it today. Do it before the prices go up. Go to rosellecare.com. My guest in studio, Dr. Scott Lamp. Scott, before we get into it, let's go to the phones. Joanne, thank you for calling. How can I help you?
Well, I'm not calling about what he's talking about. I was calling about...
It's okay.
I tell you, I have a question, and you're not over here in Maryland. So, and I've been trying to... get you on a Sunday, and it's like, I'm going to call now. What it is, I was suggested I go on warfarin.
Okay, yeah, rat poison.
Excuse me. And the other week here in the health science section, excuse me.
God bless you.
Oh, my goodness, of the Post, there was a thing on being watch out what herbs you take with what, and they gave an example of cinnamon with Coumadin or with warfarin.
Yeah, do you know what warfarin is, right? It's rat.
Yes.
It's rat poison.
Right, I know it is.
Okay.
And my husband's already on it, and I do have AFib, and but it's not severe right now. But I've been tested. You know, I've worn these monitors, and I've had echocardiogram, and
So what's the question?
So my question is, can you take cinnamon in place of warfarin?
Well, first of all, I'm going to give you my opinion, okay?
Uh-huh.
There are things that are far better than warfarin to control and keep your blood so it doesn't clot. Now, the problem with AFib is not that you have any damage, it's that your heart is beating irregularly, and all the physicians out there want to put you on some sort of blood thinner. The problem is you start bruising. The bruising that you see on the surface, that's just the superficial portion. You're actually bruising, bleeding inside. So, and not only that, the list goes on. You can end up with nosebleeds. You can end up with paralysis with warfarin, bleeding gums, blood in the urine, bloody stools, confusion. It can make you wonder what's going on, dizziness, lightheadedness. It actually can increase the problem that they're trying to fix for you. But if you go in and you check it out and you check all the elements that can take place over time, you got a problem. And so there are other things that you can do. You need somebody who can guide you through. But a lot of the fatty acids, the omega-3s, omega-6, omega-9s in the right combination at right levels are far more powerful, in my opinion, than warfarin or any of the other blood thinners. With cinnamon's an anti-inflammatory. And so you're using two things. Does it make it worse? Not necessarily, but you have to look at you have to look at the patient, you have to look at their other history, you have to look at other drugs and medications that they take. Joanne, unfortunately, we're coming up to a break. I've got to say goodbye. I hope that helps. If you want to get a hold of me, outside, please do that.
Dr. Tom Roselle and the Roselle Center for Healing present Ageless Health 2013, 3 Keys to Wellness, Saturday, October 19th at the Fairview Park Marriott in Falls Church, Virginia. At this all-day seminar, learn how you can feel better or feel great when the doctors from the Roselle Center for Healing each discuss a topic that directly affects your health, like your food, physical fitness, preventing injury and disease, your healing process, and more. Register today at agelesshealth2013.com. That's agelesshealth2013.com.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We're in the studio, 888-630-9625. My guest, Dr. Scott Lamp, your host this Wednesday evening, July the 9th. What's he going to be talking about? Uniquely male. 7:30 p.m. Give us a call. 703-698-7117. 703-698-7117. Tell my staff that you'd like to attend. Our website, rosellecare.com. ROSELLECARE. We just had a caller talk about the interaction between Coumadin and cinnamon. And I didn't have a lot of time to finish before the break, but I want to give her a little bit more data on it. The problem with cinnamon is that it's an anti-inflammatory, and there's a couple of Chinese versions. One's called cinnamon cassia, and it's a Chinese cinnamon, and it does contain a compound called coumarin, and coumarin is what Coumadin is made from. The problem is that if you're using cinnamon on a regular basis, and it's tough to know what type of cinnamon you're getting. It's not labeled, doesn't tell you where you're getting, and so forth. So what I was going to suggest is that if you're taking Coumadin, and as I said to her, in my opinion, there are many other ways of doing this far better than taking rat poison, that you probably should stay away from using cinnamon, except for occasionally, maybe you put a little cinnamon stick in something once in a while. But on a day-to-day basis, if you're taking Coumadin as a drug, probably not the best thing that you could do. So the herb that you have to worry about, or the cinnamon you have to worry about, is cinnamon cassia. It's a Chinese cinnamon, but again, it's almost impossible to know which one that you're getting. So across the board, there was an article in 2010 from Molecular Nutrition and Food Nutrition, and they were talking about the tolerable daily intake of coumarin from cinnamon, and it comes down to something like 0.1 milligrams per kilogram of body weight. So you can go in and look at that Journal of Agriculture and Food Chemistry in October 2010. Take a look at those articles, but again, across the board, does all cinnamon have a problem? Not really, particularly if you're not overusing it, but as a broad brush, I would encourage you to stay away from it. If you're on Coumadin, there's other ways of making that happen. Dr. Scott, let's talk a little bit more about men who can't get it together anymore. I was going to say something else, but they can't, nighttime is not a good thing.
The plumbing's not working.
The plumbing's not working. And the thing of it is, unfortunately, it's younger and younger men all the time.
Mm-hmm. Are you talking about? I'm trying to read your mind here. Are you talking about nitric oxide? Are you talking about the aspects of just trying to get some fluid in there? I mean, there's a lot of different things that.
This is your talk, so let's take it from the top, because nitric oxide is important. It's blood flow and the like. There's neurological pathways, injury patterns that cause it,
right.
And the thing that we've been talking about is high levels of inflammatory reactions.
And then inflammation, and nitric oxide helps move some of that inflammation. But also nitric oxide, there's actually 3 types of them. 2 of them actually help in this circumstance. So I know one that actually makes it worse. So one of the things I'll do at the talk, I'll actually go in great detail at the talk on Wednesday, is the differences of nitric oxide, which ones are good, which ones are not bad, or which ones are bad. But those are like your blue pill, the Viagra's of the world that are out there that basically actually has an inhibitor aspect on that to get the blood flow going through.
That's all NOS.
Yeah, so that's the whole aspect on that. Now, the other thing is that insulin resistance, or when you have insulin resistance, it's kind of like, when I tell a patient, it's kind of like when you have too much sugar coming to, like, I think of it like a windy day, and it's like you have your window open. And if a nice breeze coming in, you have the window open, but if you have a hurricane coming in, you close it. And we have too much sugar coming in at one particular time. The insulin's trying to grab it and put it in, and it can't, and the cell can't handle it. It's going to close it down and say, we've had enough. And so this is what they call insulin resistance, because the cell is resistant. But you also can get the same thing with different hormones. Hormones are so strong in the body that you need to have some type of system to kind of close them down or kind of settle them and balance them out. Yeah.
You got to blunt it.
Yeah. So we got to figure out the ways to do that.
So this Wednesday evening, you're going to figure out how to do it. If you'd like to find out how to increase your nitric oxide flow without having to take Cialis and Viagra and all those crazy things out there, which, by the way, have all kinds of side effects. If you've been paying attention to the news, they start listing them, and, one after the other. They're dangerous. They have side effects. They're not just something that you take. Plus, they're extremely expensive. How do you turn this matrix around? How do you, at 35, get your energy back? How do there's so many guys that come into the office anymore. They're young men. Mm-hmm. It's like when I was 35, I was ridiculous. I had more energy than 5 people. I could sleep 4.5 hours a night and get up the next morning and go. That's why I'm old and gray and bald now. But I mean, that's nevertheless, but never.
No comment.
Now, Gina, how can we help you? Gina, thank you for calling.
Save him.
I have an off-topic question. Forgive me.
It's not a problem.
My 4-year-old nephew just broke his femur, and his mom went into Whole Foods looking for calcium supplements and magnesium and D3, and there were so many options she didn't know what to get for him. What specifically would you recommend for good bone healing?
Okay, it's
for a 4-year-old.
For a 4-year-old, huh? How did he break his leg?
He was on a rock climbing wall, and he fell on his knee.
Okay.
And his femur was completely severed.
Okay, how far was the drop? Was it just a short drop?
4 or 5 feet.
Okay, so it tells me that there's a chance here that he's brittle to begin with, which is a whole different subject. And but somebody of that age should not fracture or shatter from a 4 or 5 foot level. It would have to be a perfect impact. We're seeing more and more kids with brittle bones because they drink all kinds of sodas. The phosphoric acid in any soda pulls the calcium out of the bone, and it doesn't allow it to deposit normally. Kids don't go outside like they used to. They're hooked into these crazy pads, iPads and cell phones and all those things.
Tons of lotions,
and
too.
They don't get outside, and then they're blocking, absorption of calcium. So, just as a broad brush, what I would tell you is this. You got to make sure the vitamin D level is up. How high do you want to supplement? It depends on what his levels are. Anything under 50 units is considered insufficient. Anything under 32 units is highly deficient. Mm-hmm. So vitamin D3, magnesium, boron, K2, combinations. With a child, I would make sure it depends on his diet level, make sure that his mineral levels are up, and that, he's not getting junk in his diet, that he gets outside. Bone set is an herb that's been used for centuries that helps heal fractures and things of that nature. Again, I'd have to know a lot more, but it bothers me that he's so young and suffered such a significant compound fracture like that. It's not okay. That sends up flags to me all over the place.
Uh-huh.
So,
can you say something about what kind of calcium you'd look for?
I wouldn't use calcium. No. It's not a matter of calcium. It's a matter of transporting the calcium and decreasing the inflammation. If you drink sodas, get him off the sodas completely. Get him on at least 4,000 units of vitamin D. You won't get in any trouble. K2, you can get it at Whole Foods and just use the minimal supplementation. Take it with the D. Ask them for a trace mineral supplementation and take that at least once to twice a day. But you got to change the diet. You got to get him off the junk. Otherwise, he's not going to heal. But more importantly, he's going to risk other fractures as time goes on.
And Gina, the other thing you're going to look at this too is sometimes when we're taking foods or minerals into our diet, are we breaking the foods down in the first place? I mean, do we have the acids in their stomach to be able to do that? Generally, children should have that, but if they're burping and belching and bloating and stuff of that nature, there might be a sign that they're not even breaking the food down, even if you give it to them in a supplement form.
If we can be of help, Gina, you can just make an appointment with our nutrition department, and we can help that way. Because, again, my brain right now is telling me this child's got more than just a fracture problem. That there's an underlying metabolic problem that's got to be addressed.
Okay, excellent. Thank you so much for your help.
Thanks for calling, Sophie. How can we help you?
I was very interested in your talk about androgel and the various unwanted side effects, and you said something about tumor formation?
Yeah, in any of the testosterone supplementations, if you will, you increase the risk of cancers. And if the body's at that place where the estrogen levels are a little higher, they're not being blunted by progesterone, male or female, when you add testosterone, one of the things that you see besides cardiovascular disease and strokes and heart attacks and peripheral artery disease, you also run the risk of cancer formation. And it can be testicular cancer. It can be other types of cancers. So it depends.
It's really alarming to me because my husband, his GP, put him on androgel a couple of years ago, and he really he was not grumpy. He had a good sex drive.
Then there's no reason in God's name he should have been on it at all.
Good diet, and last year he was diagnosed with advanced cholangiocarcinoma.
There you go. Yeah. There you go. That's the problem.
What is this class act or action you were talking about?
What's happening is they're understanding that these things are out there from the increased risk of the different cardiovascular problems, strokes, and peripheral artery disease. But we also know that testosterone will stimulate the risk of certain types of cancers within the body. But you have to look at the overall hormone balance, to know where they're going. I'm sorry that your husband, has had that experience. Hopefully he's not on it anymore, and that he's off of it.
No, immediately. I mean, there was too many other things to do and take care of, so that went out the door.
Yeah, what I would tell you to do, Sophie, is send me a note at rosellecare.com.
Okay.
And I will give you some directions of things that you can do. Some things that where do you live? You're in Gaithersburg?
Mm-hmm. Yeah,
okay. There's I can hook you up with somebody who understands what's taken place and what's happened, and we'll do that by the internet. Is that okay with you?
That'd be awesome. Okay, I will send you a note. Thank you.
Sophie, thank you for calling. Appreciate it. 888-630-9625. That's exactly what we're talking about.
Right. Because I think some of these things, when you start playing with hormones, you start playing even on the women's side, anything like a lot of these cancers, breast cancers, are estrogen-based. You start playing with mixing with the hormones, and a lot of these hormones can convert it to one or the other. You really got to watch yourself. And again, estrogen usually produces growth, and sometimes it goes overboard and it creates problems. And same thing on the male side. So. Got to be very, very careful with it.
Yeah, I mean, they're out there saying, take this stuff. It drives me crazy.
There's no balance.
There's no balance. People, they don't understand the mechanisms. We go to the same. We take the same courses. We take the pathology, the physiology. We take drug interactions, pharmacodynamics, and so forth. So we understand the mechanisms. How in God's name do we look at a problem from a systems point of view, how things are working, and in the traditional allopathic community, and I can't say every doctor out there because there's guys that we work with and we refer to that really get it. How in God's name do they compartmentalize everything and not understand that there's a far-reaching effect, there's a cascade that occurs and damage that occurs over a period of time?
Right. I think the American public has been sold on the aspect of quick fix. This is a quick fix, and what happens when you take any type of medication, you're going to have a change or the body changes and adapts to that particular drug with consequences. And the thing is if you go back to normal, basic things and balance it out, a lot of times a lot of these problems start working themselves out. But the thing is people want a quick fix from all the years and years and years of toxins and bad habits and so on and so forth, and they think they can get away with just taking a pill and this takes care of it.
The other thing that we didn't talk about, and I know that you'll touch upon it in the questions that will come up at this Wednesday night's presentation. By the way, Dr. Scott Lamp will be presenting July the 9th at the Roselle Center for Healing, 7:30 p.m., Uniquely Feminine. And see, this is a topic that kind of blends into male and female.
Right.
And the one thing that I wanted to say is that, ladies, if your husband is on testosterone androgel, you run a risk. You run a risk because that... you go body-to-body contact, and that stuff is going to transport into your system. Any skin creams, any skin hormones you are exposed to as well, and increases your risk of certain types of problems. This is not just, let's get my husband back up and functioning again. Not the way it works.
And it's the other way around, too. Women, you can be out there putting a lot of progesterone creams up there. It can also go to the male, and it's the exact same way. So... you're right on.
We'd love to have you as our guest this Wednesday evening. All you got to do is call 703-698-7117, 703-698-7117. There's so many. If you just get online, you start looking this stuff up, it'll blow your brain. You say, oh my God, really? Why aren't they telling us all this stuff? And the research is coming out of places like Harvard and their health guides, and it's there. It's straight up. It's not us making this up. It's all about really what we know about what's happening. Diana, how can I help you?
Yes. I had an ablation done for AFib, maybe 7-8 years ago. I'm always tired. Recently, I changed doctors, and he also gave me a blood thinner, a different one, APIX, apixaban. And anyway, after reading the precautions there, I have not taken it. I just had it filled. With the black and blue marks, the bruises, and all that.
Yeah, you're bleeding.
I'm very hesitant about taking it. I haven't started on it yet.
Well, you have all kinds of things with that drug and anything else like that, from the bruising patterns. I mean, it can affect your swallowing. It can affect, make your chest very, very tight. It can cause unusual tiredness and weakness in the body. Those are consistent side effects of those types of drugs. There's other things that you can do. You need to get to somebody who does natural therapeutics, who can look at your energetic system, see how this thing is played out over a period of time, and then give you at least options that are legitimate and allow you to think, say, hey, these are the consequences. This is what could happen. This is something that you may want to think about. And there's, both in our field, obviously we're natural therapeutics, we're naturopathic physicians and acupuncturists and chiropractors and nutritionists, but there are physicians out there as well. Unfortunately, few of them, but there are guys out there that really get their stuff and understand it. You can send me a note, Diana, at rosellcare.com, and I'll be more than happy to guide you.
Yeah, I'm also in Maryland.
I know. we're going to have to open up another office on the other side of the Beltway. That's all there is to it.
So. Yes, I wish you would have an office here.
Diana, thank you for calling. We're coming up for a break. I appreciate, but please, please, please think through it. This is not okay. Don't do things just because your doc said so. We'll be right back after the break. Don't go away.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
Welcome back. This is Dr. Tom Roselle. You've been listening to Dr. Tom Roselle Live. Beautiful ending of a 4th of July weekend. We've been here, as we are every Sunday at 12 noon at 888-630-9625. If you'd like to contact us outside the program, all you have to do is go to rosellecare.com. That's ROSELLECARE.com. And let us know how we can help you. We're always here to help you in any possible way we can. This Wednesday evening, July 9th, 7:30 p.m., Dr. Scott Lamp, my guest today in studio, will be your host, talking about uniquely male. That's, all you guys going through menopause. It's called andropause. And unfortunately, you're starting way too early. Your libido's down, your energy's gone, you can't think anymore, you're grouchy, you're grumpy. Well, I know a lot of women will say that's permanently male syndrome when we talk about that being PMS, right? Yeah. So, but anyway, that's what it's all about. Ladies, drag your husbands in. If you're on different types of medications, if you're on these androgels and testosterones, you're courting danger. There's other ways of making this happen. So please be our guest. Join us. Love to have you. I promise you this will be a presentation that will be very significant, very top shelf. Dr. Lamp, we've got a couple more calls, but I want you to take a minute and tell us what you're going to cover and why it's important and who should be there.
Okay. Again, as you mentioned before, you're talking about some people are suffering from fatigue or characterized fatigue, especially males, changes in moods, attitudes, loss of physical agility. If you get some energy aspects, sex drive is low, losing morning erections, we've talked about that previously earlier. Sleep apnea is another aspect that actually shows up with this. If you got some cardiovascular diseases, also along with even diabetes, some of these is pertinent for you to be able to see this. We're going to talk about the things that you need to take, some of the things that need to balance, either being in the mineral or supplement forms. We're going to talk about different pathways. One on the psychological aspect, the stress element. We're going to talk on the chemical pathways and the physical pathways that you can help make yourself better. We even also have one of the tests we'll do for free for you there. We have a zinc test. Zinc is a major mineral in what we're going to talk about, and basically it's actually a free test for those people that show up there, so we'll do that test for you.
And the reason why is that, guys, your testosterone and the ability to carry sperm has to do with your prostate. And the dry weight of the prostate is 50% zinc, and as you get older, it begins to deplete itself.
You like to go referring back to your paper, don't you?
I do. Listen, 37 years ago, plus, it's been a little longer than that. That's right, fourscore. No, I wrote a paper called Zinc in the Prostate Gland. And so, I have to take credit where credit's due. Because in my office, I'm like Rodney. I get beat up, I get no respect.
There you go. So we're gonna cover that, and also we're gonna cover some of the latest and greatest type things that are out there. And again, we always come back to the aspect of balance. What's the laboratory work we got to work with? What are the things you want to see, the signs and symptoms, and kind of get into them a little bit deeper. So that's going to basically what we're going to cover.
It's going to be a great class. Seriously, there's so much that you can do. Don't be the target of Fifth Avenue marketing and what limitations that your physician may or may not know. This is something that you can grab a hold of, you can run with, find out what your zinc levels are, and you'll know right away if that's part of the problem. But again, it's only a piece of it, but you got to put all the pieces together. Bill, how can we help you, sir? You got some itchy ears, huh?
Well, two things. One, I have that erection problem. I'm down to just 3 or 4 days a week that I wake up with one. But what I really called you about was I got these itchy ears, and I swab them out. I take this liquid soda, the liquid soap that's supposed to dry all by itself, like the Marines use in the field.
Yep.
And I swab them with a Q-tip, and I just clean them out as good as I can. But
okay, let me ask you a couple quick questions, because the fact that your testosterone level is starting to drop down, or not even your testosterone level may be dropping, it's just the communication. It can't transport the way it's supposed to. There's a couple things that can be consistent here. Are you a beer drinker, wine drinker?
On occasion. I don't drink. Maybe twice a month at a soccer game.
Okay, but how about cheese or dairy products?
Cheese, yeah. I do cheese, and I do milk every day with cereal.
Okay, you got a sweet tooth?
Not really. I have that chocolate, high cocoa chocolate, 2 of those tabs in the morning for the heart.
Okay, well, there's better ways of doing that, but that's neither here. We'll talk about that later. Listen, real quick, we don't have a lot of time. Anything that has to do with things that will promote mold and fungus, from peanuts and peanut butter, alcohol, things that ferment foods, dairy products of any sort, things that convert into sugar quickly, you need to get off of. Bill, I wish I could spend a lot more time on it. Tea tree oil. If you go to the health food store, you can put that. They make it drops for the ears. That'll help as well. This program is way too fast, and we got a lot of more calls, and I'd love to take them, but unfortunately we can't. You can get a hold of us offline at rosellecare.com. This Wednesday evening, Dr. Scott Lamp will be your presenter at the Roselle Center for Healing. Give us a call, schedule, reserve your seat. We're here every Sunday trying to give you way, way too much information for this short period of time. We love you. See you later. Bye.
Take care.
This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle and the Roselle Center for Healing present Ageless Health 2014, Proven Tools to Maximize Your Health, Saturday, October 18th at the Fairview Park Marriott in Falls Church, Virginia. At this all-day seminar, learn how you can feel better or feel great when the doctors from the Roselle Center for Healing each discuss a topic that directly affects your health, like your food, physical fitness, preventing injury and disease, your healing process, and more. Learn more at agelesshealth2014.com. That's agelesshealth2014.com.